Let's have a look at what is happening with imaging findings after 1 year of follow up of COVID affected patients. At admission, the most common findings that are seen is predominantly peripheral ground glass opacities, patchy areas of consolidation, and a crazy paving pattern where areas of ground glass opacities are having overlapping interlobular septal thickening. As time progresses, the density of the consolidation gradually resorbs into ground glass opacity. During this process, there is an initial apparent increase in the size of the lesion. Over a period of 3 months, the consolidation and the crazy paving gets relieved, and there is a decrease in these findings. The ground glass opacities and parenchymal bands tend to take longer to disappear. So, ground glass opacities and parenchymal bands were commonly seen to persist even after 3 months in these patients. What happens at the end of 1 year? Many of the patients, almost 90 to 98% of the patients, have complete resolution of lung findings. But there is 2% of patients who have residual findings. And two patterns have been observed so far. Some of them just have residual linear opacities, which are linear parenchymal bands, which are a proof of the previous parenchymal insult. In those patients who had severe pneumonia, diffuse consolidation, or were in the intensive care due to ARDS, they tend to have these multifocal reticular or cystic lesions that seem to persist. Some of them are also having some amount of bronchial dilation. Now, is this fibrosis or is this immature changes that could possibly resolve with time? We will have to wait and follow up to see what's happening. At the moment, it is very much possible that these changes can completely resolve. But these patients who do have these multifocal reticular and cystic lesions at the end of 1 year post-COVID do complain of persisting dry cough. Over the next few years, we'll get a better picture of the long-term sequelae of COVID-19 pneumonia. Thank you for listening.